So thank you all for attending. This is part of our social justice movie nights. It's intersection of social justice and healthcare. We try to link between some issues that we're seeing in across the country and how they relate to nurses, healthcare, so that we can see that some of these topics where people don't think nurses need to be involved, we see that they need to be very much involved. So I'd like to introduce our panelists. And if you'll just wave, our first one is Erica Branford. Dr. Branford is an assistant professor, tenure track at Texas A&M University School of Nursing. She has more than 20 years of clinical, academic, regulatory, and legal experience, and recently served as the treasurer of the Kentucky Nurse Association. Dr. Branford is also an expert in corporate, social, and legal policy. She has a doctoral degree in nursing science from the University of Kentucky, a doctoral of jurisprudence from Texas Southern University, a master's of science in nursing from the University of Cincinnati, and a bachelor of science in nursing from Purdue University. Thank you, Dr. Branford, for joining us. Dr. Joy Coles has over 20 years of combined experience in healthcare. She has nearly a decade of experience as a certified critical care nurse, working in the CDICU, and experience in pulmonary care, diabetes management, neurovascular disorders, and trauma surgical emergencies, working as a critical care pool and travel RN. Dr. Coles holds a Doctor of Nursing Practice degree and is nationally board certified as an adult gerontology acute care nurse practitioner. She currently practices in the hospital, caring for patients in advanced heart failure, heart transplant, and mechanical circulatory support. She has taught in higher education for 5 years for several universities and is currently seeking her certification as a nurse educator. She continues to hold a passion for scholarship in cardiovascular medicine and health disparities. She has championed diversity, equity, and inclusion efforts on various platforms and currently sits on committees striving to create opportunities and education centered on this effort. Dr. Coles is a wife and mom of 4, albeit a native Ohioan. She considers Kentucky home for nearly the past 2 decades. Welcome, Dr. Coles. Dr. Ann Sahingas is an assistant professor, a nursing graduate faculty at Northern Kentucky University, and is chapter liaison of the Kentucky Nurse Association. She has more than 20 years of clinical and academic experience. Dr. Sahingas is a Doctor of Nursing Practice from Walden University and Master of Science in Education, as well as a Bachelor of Science in Nursing from Chamberlain University. And Dr. Sahingas has a statement that she would like to read for us before we start. Dr. Sahingas.
Thank you. Thank you so much. This is a statement having to do with land and labor. And so we, the Kentucky Nurses Association, collectively acknowledge that our offices, as well as regions that we serve in the state of Kentucky, are located on the occupied ancestral lands of the first American nations. These lands were cared for by the Osage, the Chickasaw, the Shawnee, the Yuki, and the Cherokee nations. We recognize the history of forced relocation by the United States government of the first American nations from their tribal homelands. The indigenous peoples' connection to this land has been challenged by violence, disease, unkept treaties, invasion, forced assimilation, forced enculturation, forced removals, parental alienation, indoctrination in forced boarding schools, loss of rights, and many other colonial actions aimed at the termination of the indigenous person. However, throughout this turbulent history, this land has continued to hold great historical, spiritual, and personal significance for the original land stewards of this region. We thank the members of the first American communities and the sovereign nations in this region today for their continued service of the land and for innumerable contributions to the region and the nation. We acknowledge the legacy of slavery in our region and the enslaved African people whose labor was exploited for generations to help establish the economy of our region and the United States. specifically the production and harvest of surplus crops and land cultivation. An estimated 10 million enslaved Africans were forcibly brought to the Americas beginning in the 1500s until 1867. We acknowledge the harm that colonialism and prejudice have brought to these lands, in particular the erasure of first both Americans and African identities via prejudicial laws that segregated all peoples. By recognizing the land that was taken from the first Americans and the forced labor that was provided by enslaved Africans and people of color, the Kentucky Nurses Association acknowledges that by recognition and understanding of these errors, that we as a profession can participate in an opportunity to commit to creating a future founded on respect and engage in healing these deep generational wounds by building bridges and mutual understanding. Thank you.
Thank you, Dr. Zahingas. I appreciate that. Okay, we're going to get into our panelist discussion. If you have questions for the panelists, please make sure you put it in the chat box. We will be monitoring those for questions, and we'll get to questions at the end of this session. Okay, so my first question is going to be this. As we watched the documentary, a lot of people say, well, that's happening in the UK. That can't be happening here. I think that is one of the first things we need to address here, is that it can happen here, it does happen here, it is happening here. So Dr. Branford, would you like to start us off and just kind of, tell us your experiences and what you're seeing out there? Yes, it is happening here to nurses and to patients.
Sure, absolutely. So this is definitely a global issue. It's not just limited to different countries. We know that we just did the Commission to Address Racism in Nursing, which surveyed over 5,000 nurses in the US, and 63% of nurses reported experiencing discrimination, either in the workplace, and it affected their health and well-being, as we saw in the video. And most alarming for me was that 92% of Black nurses experienced racism in the workplace, 70% coming from nursing leaders, and 66% coming from their nursing peers. So that's a huge thing. So it definitely is an issue that is happening here. My own personal research is on peer-to-peer racism among Black nurses. So it's an issue that has been going on for quite some time. We know that racism comes in many different forms. So we've got individual racism, your personal beliefs, we've got institutional racism, the policies and practices at the organizational level that perpetuate oppression. And then we have structural racism. So how do these affect and accumulate across our institutions? And we know that there is some spillover. So how do we address all of that is really the big question. So this is definitely not a problem that's specific to one country. This is a problem that is actually just now finally being spoken upon. Racism is a public health crisis. It's a pandemic, as they said in the video. And we have been studying it for quite some time for health outcomes for other people, for hypertension, mental health, but we've never looked at it from an occupational perspective. So it's nice to be able to have this conversation and to have this dialogue now. I will say of one final note, when I started my dissertation in the early 2012, 2013, I sent out several proposals of my research to get funding. And they simply said, okay, we can't fund this. There's no such thing as racism in nursing. We're taught to all care for ourselves. I've had so many grants that were turned down because of that mentality. So it's definitely something that is present. It is affecting us. And you can also look in the chat. I did put in Reckoning with Racism, some video series that are in the US that you guys might want to take a look at. One of our nurses in the state, Dr. Jatana Benton Lee, was featured in one of the videos. And also Dr. Lucinda Canty is also one of the premier experts on this issue. And she does several webinars and seminars about this, similar to what we're doing tonight.
Excellent. Thank you so much. And thank you for putting in that reference for all of us. Dr. Coles, what about you? What do you think about it only happens there, it doesn't happen here?
Definitely. Thank you so much. And likewise to Dr. Bradford, I can say that we haven't always put a name, or we haven't labeled it as that, especially as from an occupational standpoint in regards to racism and how that occurs within the nursing profession. What does that really look like? How is that experience? And because it has come in various forms, it doesn't always present itself in the exact same way. Being able to poignantly identify when these particular things are happening, when nurses are being affected by various stereotypes and various attitudes and beliefs of others who may not understand their culture, or who may be different from them. I know there's been a lot of work among a lot of the universities, I should say, here in Kentucky, in regards to starting to formulate ideas around implicit bias in some of the microaggressions that are oftentimes, inflicted upon specifically communities of color in disparaged communities. But again, we hadn't really taken a close look in a lens into really looking at, yes, it is happening, even working in education and teaching nurses, both at the undergraduate and graduate level, and specifically referencing the graduate level, because these are practicing RNs, listening to the stories sometimes of student nurses who oftentimes will find the reason why we push for diversity and equity and inclusion among our universities, who oftentimes will find a safe place to share some of these very sensitive stories with faculty of with diverse faculty who they may identify with, that they feel safe and comfortable sharing it with. So, likewise, it is definitely happening. And I'll be honest, I'm encouraged, at least here in the state of Kentucky, and with the position that Dr. Ann so poignantly and elegantly read in regards to our position here as a collective, in regards to identifying and acknowledging racism, and that it does exist.
Great, excellent. Thank you so much. Dr. Sinkus, how about you? What do you think about this? That it only happens somewhere else, not here in this country?
Well, I think it's a way of putting kind of rose-colored glasses on and trying to just talk about some of the concepts in nursing that are wonderful, right? But the reality is that the racialization of health and the impacts to our profession really started a long time ago, and it can be traced to just this colonial identity of marginalizing the other, and that came from Europe. So it's a transplant thought practice that came from Europe that has ingrained itself here in the Americas. Using race and perpetuating this idea of categories was really a way for a pseudoscience called eugenics to try and produce a false leveling between peoples to cause separation. And unfortunately, during the very beginnings of nursing, this was a popular approved science at the time. So we can't get away from the historical, social, political consequences that directly impact the notions of health that have carried over into our profession and say that it doesn't impact, because these have been deep-rooted ideas that continue to be manifested. I mean, if you really get down to the whole notion of race, it's a pseudoscience. We're all one race. Yet this pervasiveness of racism according to levels and colors, that it doesn't exist except within the power that we give it. And so it's that power that we give it because we refuse to talk about it. We refuse to acknowledge it, and we refuse to identify it for what it really is. And I think that until we do that, we're never going to get past it. And the reality is every generation has to kind of work through this because it is so permeated within, within our whole system.
Thank you. That's powerful. I do want to go back to something that Dr. Coles mentioned about nursing students and, how they see racism as they go through their educational process. I want to know, how has the racialization of certain nursing populations limited their education, professional opportunities, and institutional power? Dr. Coles, do you want to go first with that?
And I'll just speak honestly, just general here in that regard. I do know, and it's been well documented in regards to students of color feeling or have an experience of being marginalized. And quite frankly, some assumptions essentially being made in regard to their ability or even in entering. So when I think you asked a three-pronged question in regards to them entering into the workforce. And so I know that students have oftentimes felt somewhat at a disadvantage and have even, sometimes, and even in the literature and surveys and things that have gone out, identifying their thoughts and feelings of feeling marginalized, or even this kind of insidious and pervasive thought that I've got to do more, I've got to, or I've got to somehow even oftentimes prove that I earned my way to be here, that it wasn't somehow given to me, and that my educational experience, or that the way in which I've arrived here to be able to provide care to patient was a valid experience. And so just that sense, and I know they talked about that in the video, that's it's almost like a pervasive thought that's always there, that, in some way, shape, or form, there's this proving that often may have to happen. And some of the various comments or things that one may not be aware puts a student or a graduate in the mind frame of believing that somehow they must prove that they've earned the right to be in the room. And so it's those kind of the undertones, right? It's the microaggressive and albeit sometimes unaware comments that may be made, that, oh, you went to this particular university, or a comment that puts a student, I'll be quite frank and honest with you, to not put an specific shared experience of a student out there, but just that general, the comments that are made that make them feel as though they have something other to prove in order to be recognized for being able to be worthy, if you will. And so I know that some of the nurses in the video talked about that as well. And that's a pervasive and an insidious thing. So being able to identify the way in which we engage and speak, the words that we use, words matter, and how we deliver our questioning is so important, to not place, a nurse in a position to feel as though her experience is different from others.
Mm-hmm. Yeah, thank you so much for that. Now, Dr. Branford, you mentioned access to research monies. How do you see race limiting education, professional opportunities, and institutional power of Black nurses and other nurses of color?
So I like to use the term people of the global majority because we're not minorities, we're people of the global majority. But what has happened is that we are in an inequitable state. So there is no equity. We're starting below the line, and we have so many different obstacles that people are having to encounter just to get to college, to get admitted to nursing school, to get through nursing school. So we don't have the systems in place where someone can give me their study notes from a year ago and help me get through this class that I'm struggling with. So there's some exclusion there. There's also a lack of communication in nursing schools and in the nursing workforce about racism. I think that we have to talk about it. That dialogue has to be there. We can't just say, okay, we are going to address cultural diversity. Well, what is cultural diversity? And you can't discuss cultural diversity without talking about racism, implicit bias, microaggression, macroaggressions. These are all parts of that process. And so if you come into nursing school, as Dr. Coles so eloquently put it, and you feel already left behind, when you get into that workforce, those feelings permeate. And you may feel, yeah, that I might not belong, or I didn't go to this school, or I went to a historically Black college or university, or I personally went to Purdue University, and to see other graduates, I was treated differently depending on what school and my race, that I went to. My experience was somewhat different. So you have so many different factors that play into it. And historically, we have to look at it, as Dr. Sahinga said, historically, the profession has been divided. And I think that is something that is so unspoken. We just continue to kind of glaze over that fact. Her statement was so powerful because it addresses all of these things, but we glaze over the fact that we were a separate but unequal profession. If you ask nurses in general, who was the first Black nurse, they could name Mary Eliza Mahoney immediately. But what other nurses influenced nursing? What other diverse nurses of color, men, et cetera? So I think all of those things really, get into your mind. And then you hear things in school. I'll give a personal experience of when I was in nursing school. In my OB class, one of my nursing professors said, oh, Black women crave dirt when they're pregnant. And so most students would just sit there, most students of color, but I'm not that type of person. I'm a person that asks questions because I know what the truth of that statement is. People of color have a taste, or they crave pica or clay, the dirt that vegetables were grown in from the South. So it's things like that where we're having a lack of diversity in nursing education, and we're teaching things the same way that's been taught for so many years. So if we don't have diverse people educating, if we don't have diverse research scientists, if we don't have diverse students, we're never going to be able to really address and eliminate this problem. And I don't know if it's possible to truly eliminate it. It's something that will just stand because, as Dr. Sahinga said, class, race is something that has been structured and said that race is, put you at risk for disease, which is not true. There's so many other factors that put you at risk for disease. Stress, because I'm Black, puts me at an increased rate for disease. It's not the pure fact that I'm a Black woman that I have a higher risk for maternal and a child dying or dying during childbirth. It's the fact that I've experienced so much compounding stress throughout my life, racial stress, personal stress, occupational stress. All of those things take a part into how we look at diversity and what we see coming in. So I think it's really the bigger issue of equity that needs to be addressed. And sorry if I talked too much on that question.
No, thank you. Thank you so much for all of that. Yes. Dr. Sahingas, what about you? How has race limited education, professional opportunities, and institutional power of nurses of color?
Well, I'm going to toggle on to what Dr. Bradford said and what Dr. Cole said. And I'm going to speak a little bit specifically about just nursing education, right? Specifically, when we think about nursing education, we think about our textbooks, and nursing textbooks, which are kind of the basis of our nursing knowledge, they very rarely include a diverse perspective. And very often they perpetuate, as Dr. Bradford said, stereotypes, and they cement biases in practice through case scenarios, simulations, and patient provider experiences that we encourage, right? So nursing textbooks often don't contain written references. They're literally inputs that have been kind of rewritten over and over and over again. Minority groups, they're not even really, there's no information that comes from them. So the information is stagnant. And this really limits not only the education of minority nurses, but all nurses, because it limits their ability to be able to think about care the way we want them to, patient-focused and holistically. And an example that I can give you is pulse ox. Right? Pulse oximeters were not calibrated for darker pigmentations for people with melanin. So when a person of color is given a pulse ox and you're reading it, it will show that they are at the appropriate levels when in actuality they are not. So when you consider the care of many of the people of color during COVID who were probably sent home when they should have had oxygen and they didn't, because nurses didn't realize that there is an error with pulse oximeters in people of color. These are important things that we should be, we should be growing in knowledge, but we're not. And a lot of that stems, I think, from the fear of exploration. The spirit of inquiry gets stunted when it comes to nursing education and culture. We are afraid to kind of push the door open and to kind of lean into that discomfort a little bit and kind of get into, what else do we need to know? Why is it important to have diverse educators, researchers? Well, because they bring that knowledge that we're not getting now. They're going to push it forward. They're going to advance that. And so I think that that's a problem that we're seeing in nursing education. How does it limit our profession? I think that it limits our profession because it hinders the growth in the profession. And I think it impacts all of us in a negative way.
Thank you for that. So you talked about education. My next question is, we have all these nursing leaders. What can nursing leaders actually do to address racism within our profession? Can I start with you, Dr. Sahingas?
Sure. I think the biggest thing that we can do is really to understand that biases exist, prejudice exists, discrimination exists, all of these things exist. And we need to acknowledge that and be fearless in acknowledging it to push forward. Imagine if we were nurses at the bedside and we were afraid to go into a code because of what we might do or what we might see. And so I see our inability sometimes to kind of broach this topic or to even bring it up with leadership and institutions as kind of that situation. You're standing at the door, there's a code, and you're not entering. So don't be afraid. Don't be afraid. I believe it's important for leaders to cultivate a culture of cultural competence and to address microaggressions, inappropriate comments. These are some basic things that will have really big lasting ramifications to not just people of color, but to your whole institution, because it's going to build up the morale. It's going to build up your ability to actually kind of form a team mentality. So these are important and simple steps to start with.
Thank you. Thank you so much. Dr. Coles, what about you? What can nursing leaders do to address racism within nursing?
One is, I love how Dr. Ian put it in regards to not being afraid to start that initial step of inquiry and identifying and also stating, taking that position that this is a pervasive problem, identifying that first, and then not just saying we're against racism, but actually actively being anti-racist. And what I mean by that is all the action that ensues when one takes on a position of being anti-racist, making certain that they're aware of what the issues actually are and how they exist and where they exist, and more importantly, even maybe why they exist. Historical context is important. And there used to be an old saying that I really haven't heard said much lately, but it will forever hold true that you repeat historical things that you don't understand and that we don't continue to keep out in the forefront so that we don't make the same mistakes. And so Dr. Branford and I believe Dr. Ian both brought up a very poignant point in regards to keeping, this is a perpetual thing in every generation, in every new generation of nursing. And I think there's a great opportunity among leaders, among our nursing educators, to essentially make certain that this is a topic that stays in the forefront of what our future nurses, as well as our current practicing nurses, it's a skill, much like the other various skills that we have as nurses in providing, importantly, good care to our patients. But we've seen, especially through this pandemic, the care that has to be provided for ourselves and for one another as a profession. So I think having focus in regards, an actionable focus on anti-racism with very clear deliverables that denote what are the microaggressions against disparaged or these and people of persons of color, and all of the other things that ensue are included in what racism look like within our occupation, actually identifying those and then having an actionable anti-racist plan that is perpetuated throughout our nursing education and out throughout our profession from it till end of time, really.
Thank you for that so much. Okay, so Dr. Branford, I'm going to put you on the spot because Dr. Coles mentioned anti-racism. I want to ask you, what do you see as the role of white nurses in their allyship against racism in nursing?
Okay, sure. I'll start with something that a word that I've heard the saying about people of color. So I'll just start with that. We are not invited to the table until there's a crisis with a white woman, and then we are together in it. But when we ask for that support, we don't get it. So for me, it's like, this was an issue before George Floyd. So why at this point is it so important to the profession that we discuss this? And this is what nurses of color want to know. We don't want to constantly hear from the same people. We don't want to constantly get reports. We don't want to constantly get your apologies. We want to see action. We want to see you get down into the trenches. We want to see you understand what we need as individuals, as nurses, as frontline nurses, as students. So it's just several steps I think that you can do in order to make that happen. Is one is you appreciate other people's races and cultures. You have to have an appreciation of that. That piece starts within. It's an individual piece. And then acceptance of people. You cannot base your opinions on people based on your biases. You have to understand that. And then you have to assess your deficiencies. So what are the deficiencies that you experience, that you see? And then you acknowledge. Once you acknowledge past grievances, that allows a safe space for dialogue, to talk about what's going on, to talk about what's happening, and take accountability. I think that is a big issue, is that people do not take accountability for their actions. And it's easy to atone if you have a mistake or you have a misstep. and action. Again, we need meaningful action. And in order for us to achieve equality and equity, diversity, equity, inclusion is not going to be enough. We're going to fall on our swords and die, because in workplaces and all sorts of cultures, we think the answer is diversity, equity, inclusion training. Well, that's not the answer. It's not solving problems. So you can put a DEI person in place, but what is that changing? You know, what do we see happening? And did that answer your question all the way, Teresa? I want to make
Yes.
sure. Okay.
Yes, I thank you for that. Because that's kind of something that I fight with myself all the time. Is I want to be an ally, but I can kind of be pushy and verbal about a lot of stuff. So I don't want to feel that I'm either pushing someone to the forefront that doesn't want to be pushed there, or that I'm stepping in front of someone who does want to be, in the forefront, talking about these things, making decisions about these things. So that was a big thing for me, is how, as a white person, can I be an ally to help the experience of Black and other nurses of color have a better experience within the nursing profession.
And I think it's very important, and we have so many allies, so I don't want to come across as, oh, we don't have allies, because there are tons of people. I know, KNA is huge allies. Kathy Hager is a person, you, Teresa, the people that I've met are huge allies. And I think being able to bring people in and, acknowledge that, it's like each one teach one. So you're an ally, you know what it takes to do this. So you teach another person what it takes to do this. And eventually we hope to get a domino effect where we have that allyship that's happening. But until we have more nurses that step up to the plate and that can acknowledge this, accept it, and take accountability for it, I think that plays into why there's less allyship than what we would want it to be.
Dr. Coles or Dr. Sahingas, do you want to add anything to that?
Yes, actually I do. I really feel like when we talk about allyship, I think it to me, it means getting down in the trenches. And what I mean by getting down in the trenches, it means getting your hands dirty in helping support in a very personal way. It means, I am 0.1% of the nurses in the nation. I'm Native American. There aren't a lot of us. We are less than 1%. And so that means that for people of color, we need mentors. We need people who are going to help mentor, help grow, help students. And that takes a lot of personal time. It takes a lot of personal effort. It takes a commitment. And lots of times when we talk about culture, it's really easy to kind of live in this ethereal plane, when really what we need is the commitment from our peers. I don't have a lot of peers. Like I said, I'm 0.1% of the nursing in the nation in my field. So I don't have a lot of peers. I can only mentor so many people. I need my nursing peers to step up and step out and mentor students that are that may not necessarily come to the colleges. I need nurses to get out in the community so that people, young people who may not normally think that this is something that they can do, can maybe be called into the profession. This is how we grow diversity. We can't sit in our offices and just think it's going to happen. We have to go out, put our boots to the ground, and we have to grow diversity. And I think by doing that, you're going to get a lot more than what you think, because you're going to have that interpersonal relationship that's going to transform you, and it's going to transform the people that you're involved with.
And I'll add to that and say, as part of that mentorship as well, there cannot be an environment where you don't feel free to have that dialogue about race, racism, about bias, about differences. That has to be a part of the mentorship process. It truly does. And mentorship is so very important. But I think that sometimes people need to be trained in mentorship. It doesn't come naturally for all people. So you have great mentors who open up doors and show you things that you never expected from any race, creed, or color. But you have other mentors that just take on the title of mentor and don't actually act. So like you said, we've got to have actionable steps. We've got to have some measurement of what is mentorship, what is allyship, what am I doing? If I see a person being wronged on the job, what do? Do I stand there and watch, or do I speak up for this person and say, okay, that was inappropriate? You don't go and touch Erica's hair because it's short. You don't do things like that. So you have to speak up when there are microaggressions, when there are macroaggressions, when there are situations where people may be talking about patients. It was just a Twitter. There are two things that I just want to quickly bring up. On social media and TikTok, there's a thing called Nursing While Black. What do you experience? And also an OB unit just did a video that perpetuated so many different stereotypes. And this was on TikTok, social media, and no one stepped up. No one said anything. It took someone who was not involved, who was in Tennessee, and these nurses were in a different state, to say, hey, this is not okay. So it's so many different layers to it. It's a very deep, complex, and layered issue.
Dr. Coles?
Yes, ma'am. I mean, honestly, just to round that out, nothing real poignant to add to that except for the deliverables. Allyship requires that there are deliverables. What is going to happen, aside from you informing yourself and understanding and knowing where what these things are and what's happening, that there are actionable items that ensue afterward. And so it has to be coupled with what do you do when you do see, it's much like what we do with anything else that is detrimental in our society, whether that be terrorism. The first thing they tell you, if you see something, say something. And so allyship starts with say something. There's this innate consciousness that we all have inside of us. We inherently know that, something just wasn't quite right about that. It's not just commenting on someone's hair, asking them, is your hair real? You have to really ask yourself, if I saw a white young lady with long hair, would I just make an assumption that it wasn't her hair? But if I see a Black young lady with long hair, I make an assumption that it's not. And so then I have all of these questions that ensue that are, quite frankly, could be deeply personal for that person, and be considered a microaggression. So we inherently and innately have that inside of us that says, I'm overstepping here. Or I may be asking a question and really asking yourself, why am I asking that question? What is it, would I ask this of anyone? Or what is it that's really prompting me to go down this line of questioning and really have that talk within yourself? And that's what I think we also have to do, and we have to help our nursing students and our will-be nurses that are coming down the pipeline, and those who are currently practicing, helping them identify what those conversations that they should be having with themselves, and really checking. That's the implicit bias piece, right? Really understanding and checking within yourself, why am I asking that question, or what's really behind why I think that way? And so again, just if you see something, say something. That's the best ally anyone can have, is to know that they have their back. I consider an ally someone that if something's happening wrong to me, then they're not going to idly sit by. That's not an ally. Within our United States government, our allies, if they come to our side in the event that there's something that happens, they join forces with us. And so that's allyship. And I think that's a great start for what we can do to continue to move forward.
Great, thank you so much. I do want to leave some time for questions from the audience, but I do, we are working on workplace safety and violence prevention. And I just want a really quick, short explanation. How do you see the relationship between racism in nursing and, workplace violence? In its different forms. There are several different levels of workplace violence, but how do you see racism and its link with workplace violence? Whoever wants to go first.
I'll go first if that's fine. For me, it's that historical piece. We have people that have, bias. I always want to make this statement that just because you have implicit bias, we all have implicit bias. It does not make you a racist person. But when you take it past bias and you take it to, you have individual racism toward a group or toward a person, that can turn into a very critical situation. Maybe you're one-on-one in a patient room and they are, very aggressive towards you. They, are talking down to you. That could create a situation in the workplace that is violent, and it puts you at risk. There are situations where nurses have been called outside of their name, slang words for many different races, and hit or grabbed, choked. We have people bringing guns into emergency departments. We have people in OB units that don't want nurses of color taking care of their children. So all of these things have the potential to escalate. So I just think it's just very important to be aware. And that too is another reason why we need allyship, because if I'm in a situation, I'm going to need someone there to help me and to speak up and to stop this from happening. We're in this together. And, that's just really what it really hones in as, is that we have to all be in this together.
Absolutely.
Excellent, thank you.
And I would just add that even what KNA did, and I'm trying really not to get emotional here regarding this, because when I first learned of the position statement in regards to the historical context of where we are in some ways paying homage and promoting reconciliation among just the simple act of acknowledgement was meaningful. And so when you talk about racism in our profession and you're talking about violence, just like any other violence, there's 0% tolerance, right? We don't tolerate certain things because of the harm that can happen as a result of that violence. And so there's a lot of work that still needs to be done in regard to making certain that people understand the harm that happens when someone of color, someone of a different ethnicity, a marginalized community, these types of things are perpetuated, these assumptions are made, how hurtful that is behind the activity, albeit it even may be implicit. There's hurt that happens as a result of it. So I mentioned the KNA position because it's that type of action, acknowledging it, making a clear line in the sand as to what we do and do not stand for. I think that's important. And the same thing goes for when you're talking about workplace violence. There's no tolerance for it. There should be measures to mitigate it. There should be purposeful effort and policies centered around prevention of it. And when it does happen, if it's purposeful, if there's opportunity for learning, or if this really requires discipline action, that's where our nursing leaders, they have a tall task to begin to put these things in place so that it can be dealt with as serious as any other violence, because it really is. It truly is.
Dr. Singh, you have something? Go ahead.
I was going to say, I think both Dr. Cole and Dr. Bradford said it beautifully. And the only thing that I could really add to this would be to really kind of hone in on our holistic sense of nursing, right? When we talk about violence, sometimes we think about these isolated things of a patient saying something or a doctor saying something, but I think it's important for us to understand that any kind of hurtful biases or prejudices, they leave a lasting impact on a person's mental, their spiritual, their physical health, as well as their overall quality of life. And one of the things we talk a lot about in nursing, and we push a lot in nursing, is healthy nursing, right? Be a healthy nurse. Well, in the day-to-day of a nurse who is a person of color, they are enduring multiple times microaggressions. So it's kind of an injury of 1,000 cuts. And so at the end of the day, it's not just that they've had the hard shift. It's not that they've been overwhelmed with patients, but they're also dealing with this injury that is impacting immensely their mental, physical, and spiritual health well-being. That's impacting their quality of life. And then we also talk about nurse suicide. Well, kind of throw that in the whole mix. How does that impact the nurses of color? So as a profession, we need to think about these things with each other, because in order for us to be good advocates for our patients, I believe we have to be good advocates for each other. If we can't do it for each other, we have no business doing it for patients, because our empathy isn't real. And so that's the challenge for the nursing profession, is we need to be able to do this for each other so that we can truly reach the depth of caring for our patients.
Thank you for that. Thank you. We can maybe take one or two questions. Do you have any questions from the audience, Delanor?
I do. I have a lot of really good questions and phenomenal comments. But one of the questions that I think could address many issues is, what if leaders don't step forward when you report something that was a microaggression or a macroaggression? What do you do? And I'd like to throw that out to anyone who would like to step forward on that question.
I will gladly step forward on that because I had an issue. But there's a such thing called policies, and policies give you the grievance process. So if you make your grievance to your nurse leader and your nurse leader does not act, there's a second line that you can go to. And if that second line refuses to act, there's a third line you can go to. And if that doesn't work, you get you an attorney and you file a complaint with the EEOC. So that's how you handle situations like that in a nutshell.
Oh, thank you, Dr. Bradford. Okay, next. Next, there was a comment in the chat that said, is there something that we should be doing for allies to train them how to be allies? And so, Teresa, I'm gonna throw that out to you, because after all, you're the only white person who's on the panel.
Well, I think it actually starts at, in our educational institutions. I think Brenda Hackett here has an excellent comment. She says, I have found that in conversations about culture, many white nursing students don't see themselves as part of the discussion. And I would also go ahead and say, probably not as part of the problem either. None of us want to see ourselves as part of the problem. But, if none of us were part of the problem, there wouldn't be a problem. So I think it has to start. We have to have our educational institutions feeling more comfortable having simulations, having these hard discussions, because for some people, they are hard discussions. They don't see themselves. How can they be an ally? They don't see themselves as the problem. So I think it needs to start there, so that when they get out in practice, it's not too late. Because I think sometimes when you get out in practice and you're practicing, it's too late, because you, as a student, they are a captive audience. You have to have these discussions. Whereas when you get out in your own practice, It may be something that you look for yourself, but not every nurse is going to. So I think it needs to really start there.
And I would add to that, Teresa, too, is that, for things that people don't see themselves as part of the problem, those are opportunities. So you can look at that as an opportunity to bring a person in as of color and open up that discussion. I think open dialogue and discussion is how we're going to bring about change. So you may not see yourself as part of the problem, but we're all part of the problem. And that's why I say it's individual as well as it is collective. So it has to be included in all things, and it has to start early on. We can't wait to their last year in leadership to discuss this. This is something that has to occur when they first come to nursing school. And I think as nurses, we have this,
Erica, I'd like
yeah.
to jump in there. We developed a curriculum for implicit bias for all of the schools, the nursing schools, and the Kentucky Nurses Association gave it away. We've only had 16 schools and programs to download it, and they are supposed to implement something by August the 1st. Now, I'm sure that there are schools that are going to be developing their own curriculum, but 16 out of 64. And this is a great opportunity to teach students how implicit bias impacts and harms patients. And being aware of biases can save lives. So, Teresa, do I have time for one more, or do you want to close it off and go ahead and do your closure?
Is it a good one? They're all
They're
good.
all good. Let me tell you, there's not been one comment or one question that hasn't been wonderful. Okay, so this is just a comment, and I think that this will lead you to talking about more things that the KNA is doing. Time and time again, I've seen patient cases where they poo-poo a person is always BIPOC. The African American always has the hypertension, and that has to stop. Poor person. So I think that what this person is basically saying is that people of color are dismissed in the workplace.
Yeah.
In the chat that talks about
that talks about hierarchy in leadership and how people of color, BIPOC, are not acknowledged with opportunities for leadership.
Mm-hmm. Yeah, and I think that's one of the pieces of this too, is when you talk about mentorship and you talk about seeing people that look like you, we have to see more people of color and Black nurses in roles of leadership. We just have to, or else I don't think any of this is going to change.
Well, that's one of the things that leaders can do, is make those selections and consider people for their experience, education, and accomplishments, and not just for the color of their skin.
And that's an actionable and deliverable form of allyship.
Absolutely.
Black nurses that you see something in them. They're engaged. You see the passion that they have for patients, and you identify their skill set, mentor them, and help bring them to the table for those leadership positions, give them access. So that is definitely that's a deliverable for allyship.
Yep. And I just want to bring up one comment that I saw, is that several nurses on this call have DNP, APRN credentials by their name, and it's sending a positive message to nurses who need to see this. And I think that's so important, is that we all have an ability to make an impact. And so that's really what we need to do, is make an impact. And there's so many different ways, small and large, that you can make an impact.
All right, I want to thank all of our panelists. I knew this was going to be a excellent discussion, and you guys did not fail. It was rich. It was meaningful, and I hope that when this gets recorded and put up on the KNA YouTube site, that we get a lot of people that watch it, because I think they'll learn a lot from it. I did want to mention some things that the KNA has upcoming. We have our KNA Election Candidate Forum on July 28th. Please sign up for that. KNA elections are August 1st through 31st. We didn't have a very good turnout for elections last year, so we're hoping that we can at least have 20% of our membership show up and participate. In September, every Thursday in September, we are going to have town halls with our legislators so that we can see where they stand on issues that are affecting nursing and healthcare and patients. So we hope that you'll sign up and watch for those. On October 4th through 6th, there is an infection control boot camp. That's from, is that from Norton? Is that from Norton? Yeah, it's from
Yes.
Norton.
Yes, yes.
So we hope that you will sign up for that. And then from October 6th through 8th is the intertribal event. That is that up on our website, the KNA website?
Not yet, but it will be soon, but Anne could speak to
Yeah.
that briefly.
Yes, and would you like to mention that?
Yes, I definitely will. October 8th and 9th, there is an intertribal water gathering, and it's educational, it's cultural, it's open to the public, and it'll allow students, faculty, nursing, the ability to come and explore Indigenous culture. Also, for any nurses who would like to volunteer, the KNA will have a booth there where they'll be doing some health screening and COVID testing. And so it's an opportunity for you to come and help do some community service. But everyone is welcome. It is a paid event, but it's 2 days, so Saturday or Sunday, and it's in J-Town. So I'd like to see you there.
Great, thank you so much. Just a few more things. November 3rd through 4th is our conference, People, Passion, and Purpose, a World of Opportunities. So look for that, and it's up. You can sign up right now. And on November 1st, we're going to have our first Leadership and Legislative Academy. Normally, something like this is very expensive. It is free through the KNA. Really good opportunity for bedside nurses, I think, to attend something like this so that they can see their potential and become the leaders that we need out there. So again, thank you everyone for attending. Thank you to our panelists. I really, really enjoyed this so much.